Madis Tiik, we're here in Estonia, and last time we talked was, I think, 2016, and you explained how you built version 1.0 of the healthcare system of Estonia. And now we are, and then you are a GP, and you started from that perspective, and you integrated the whole society. From 2016, when they had the first version of the shared healthcare data, what has changed? Now we're talking about 2023 when we're sitting here.
Firstly, we started in 2009 to integrate different healthcare providers to share the data.
Yeah.
But it took 5 years to where the really data exchange happened, because we started from scratch. We didn't take the history with us, and there was not too much to share. Mm-hmm. But after 5 years, around 2015, the healthcare provider started to send a request to ask more information. Patients started to look from the patient portal about the medical histories. So it started to flow the system. So it took 5 years after implementation.
Yeah.
So.
Yeah, and the lessons learned, we can think about it. You say, first, we did not take the history with us. That makes it more simple. That's very important. Because
it was not structured, and it was not possible to structure it in such way that we can reuse it. So, yeah. And we decided not to take the paper version with us. We started from scratch, from empty database, and from 1st of January 2009, every Estonian has a digital record.
Yeah, detailed record. And that was only a selection of what the hospitals had about patients, or the GPs had of data. The more essential, you defined the most essential piece of information of the different hospitals and the caretakers, and that went to the national system.
Yes, it is correct that we agreed certain amount of most important information, which is shared over the National Health Information Exchange platform. Mm-hmm. Of course, there are still more information which is collected during the hospital stay, but it's not necessary for others in the future. It just remains in the hospital system.
So also know how to limit yourself. Don't take everything, don't do the history, don't make it too complicated, make it more simple. The most important document which you wanted to share from the hospitals, what was that?
It was like summary letter or discharge letter or
discharge
epic crisis, discharge letter.
The discharge letter.
It's summary of the hospital stay.
Yeah. And so limit yourself to what's possible. Secondly, you worked very effectively together with the law. I mean, there was just a law where people were saying you have to share data, right?
Yes, it's written in the law that every healthcare provider have to share certain amount of agreed and standardized data. Mm-hmm. And healthcare providers have to look the data when they are taking care of the patient. So if you are not looking the data which is available, and you make a mistake, it will be against you that you didn't look existing data.
And also, if you look at data which is not your patient, you're also that's also not okay.
Yes, you are excluded from the system, because you don't have a physical, let's say, barriers to access to the data. You have to have the caring relations with the patient, and it's monitored because we are using only strong authentication, and every usage will remain a trail.
Yeah, so that is also one thing. And also the third thing is, there was this rule, don't store anything twice, 3 times, 4 times. Like our patient addresses are into maybe 50 different systems.
Yeah,
that's not allowed.
It's the general rule in Estonia that data, it's only once rule. So it means that if the data is already stored somewhere, you have to ask from the original source, and you are not allowed to copy the data and use it, or ask from the citizen, because if you already once have the data, you have to ask from the original source.
Okay. So those were the rules, those were the things. In 2014, everything started. 2009, you started to build it. When was it finished? The first version? It's never finished, but when was the first version reasonably finished?
I think that it took some 10 years. We can say that all sectors, let's say even hospital, ambulance care, dental care, school health, all providers are connected.
Yeah.
It didn't happen in 1 or 5 years because we went step by step, different user group and more information.
Yeah, okay. And where are we now in 2023 with the system?
I think the system we started is now in the end of the life cycle of the IT system. So we are
another rule in
yes.
So what is that rule?
It's the rule that we should replace every 12 years this kind of crucial system because it's the technology is changing and we have to replace it. Otherwise,
who came up? That's in the law.
It's not in the law, but it's the like good habit or recommendation. The similar like this the only once is it's not law,
no.
But it's the principle. It's one of the principle of digital society.
Yeah. Every 12 years, and we all know that software takes a lot, lives a lot longer than that. So okay, that's a good rule. But now, do you think it made the whole system more efficient?
Yes, definitely. It has made a lot of positive reactions. First thing is that you can access your patient data using only one interaction with the national system. You don't have to take care of how. Now we have built a lot of this kind of reuse of the data. For example, we have this kind of data viewer. So you don't have to look each of the document, which is because our system is document based. Mm-hmm. You have this viewer which will collect you already the view.
A dashboard
of the patient.
As a patient, I have a dashboard, yes. And as a doctor, I have a patient.
Yes.
As a doctor, I have a dashboard.
Exactly, and then it helps you. For me as a doctor, when the patient is coming, before that I open the viewer and I see the dynamic of last 10 years. So I can see how the lab tests are changing, what are the different, let's say, measurements. So I have quite quickly a view what has happened with my patient during last 5 or 10 years.
Yeah. So you have all the information. It works all smooth and wonderful. Now, ask you, what is the result? Because if you look at the average age of an Estonian man, healthy years, compared to a Swede, how many years are they living the same amount of happy, healthy years?
Unfortunately, not. Our cap is around 20 years. So Estonians, men, live 55 years, healthy life years, comparing 74 in Sweden. So basically, even we have fully digital e-health system, we haven't reached let's say, we haven't changed anything.
No. You have all this beautiful digital, healthy, efficient stuff, but it's not helping to make people live healthier lives.
No, not yet. Oh. But now.
Why is that? Why is it only the Estonian men or also the women?
The same, yes.
Okay. So what is wrong with? Why are they having such a big difference in healthy years?
Firstly, we are only at the moment looking the sickness data. So we're collecting the data about the sickness episodes. Mm-hmm. And the sickness episodes usually starts from the patient side. They decide when and what they want to do. Mm-hmm. And
when to visit the healthcare provider. Yeah.
And this is not always let's say need-based. It is demand-based healthcare. It means that
when there's a problem. When there's a problem,
When I feel that it is problem, or I think it's problem, maybe it is not the right place where I go. Mm-hmm. So now, because we have this long data set, and we have more and more knowledge about what works, what not, we can, let's say, focus and focus to each of our patient and give them, let's say, this kind of longitudinal view in the future.
Yeah, what can may happen. More specialized. But let's stay for the problems for a little bit, okay? 20 years difference between the Swedish man and the Estonian man. Why? Why? What are the basic fundamental reasons?
Mainly habits, drinking, less physical activity, and nutrition. So these habits which are taken.
Stress.
Yes, stress, of course, and we have been like struggling to survive for centuries. So we're still running like a mouses in the circle. So it's very it has been very.
It's nothing to do with that the Swedish society is richer. There's more money. It's stress based.
It's stress
and it's habits based. Why don't they sport? Why don't they do sports? Or why do they smoke so much? Or why do they eat bad fat food?
I think they have been more time to support these changes in the society. And this is not healthcare problem. This is the cultural problem. This is political, let's say, things. Where to spend? Estonia needs to spend more money to defense. So our priority is to fence ourselves. We don't have money to spend to the healthcare. So, because if you lack money, you make choices, and.
Yeah, but I mean, if I would spend more money on healthcare, I would fix more people up when they have a problem, when they have cancer or when they have obesity.
Yes,
how can you change people's life of having habits?
Yes.
Being more, doing more sports and eating better food, and if that's the real reason that of these 20 years,
yes,
or less stress.
No, firstly, we have a totally failed prevention.
Okay.
And prevention starts too early. We mainly have secondary or tertiary prevention. It's after you have already stroke or so we find those patients under the risk too late. So now we can use the data.
Is it better in Sweden?
I think so, yes.
You are very much experienced because you implemented the healthcare system of Estonia, the digital healthcare system of Estonia in Finland. And you lived there for 2 years.
6 years.
6 years. Are they doing it better? Are they having better habits?
Yes, they have. They started already this nutritional and these preventive measures in 70s, and they really achieved better results of life expectancy and lowering LDL cholesterol and all things. And this is all new. We are now only starting. Learning from Finland, these good examples, getting the rich data set, personalize the service, personalize the prevention, trying to find these patients under the risk as early as possible and try to motivate them to be healthy.
Yeah, your idea is if I know more about the personal situation of the patient, and I can say, if you do not change your life, you're going to get a heart attack, or you're going to get obesity, so you're going to die because of this. You believe that better medical information by using all kinds of different things, the data sets, the genomes or other things, that you can convince a patient to change his habits?
Not only. This is maybe to have a more evidence-based information what you can use. But we need, again, supportive systems for the patients who will take care of the behavioral change, and we need also political consensus that we are limiting for access to the alcohol consumption, rising taxation to the sugar or some. So we need a public campaign because the awareness of these risk factors are not there. So we need a comprehensive approach.
Isn't that really hard?
It is extremely hard.
Isn't it really? Yeah.
It's extremely hard.
I mean, you did this whole digital, national healthcare system, which I think is amazing that you did that. But you had a really nice crisis and you did it on the right place at the right time. But this seems like 100 times more difficult. Changing the habits of people.
Yeah, it is. Changing the habits of doctors. How they treat the doctor. How they think. I see many patients who have high cholesterol. for years. And I asked, has no one told you that you have high cholesterol? No, the doctor said that let's look how it develops. Maybe it goes down and we don't start the treatment. So it is also not only patients, but also attitude of the caregivers, that what they believe, how convinced they are. If you starting some medication or some intervention, you should be convinced yourself. You have to believe yourself. Otherwise, you can't convince the patient.
Yeah. Okay. So this healthcare 3.0, what you call, making the patient central, changing his habits, giving him personalized information. That's what's only starting now in Estonia, right? What kind of project are you doing to get that closer?
Firstly, we try to optimize the workflow of the caregivers. So we establish symptom checkers and digital entry channels for the patients to be able to have, let's say, need assessments before patients are entering to the appointment. So we can more precisely guide patients to the right services. So we optimize the system. And we release time of the doctors and nurses, which can be used to convincing patients to be more, let's say, proactive in prevention, for example, to spend time more to the prevention than to the acute care. So, but for that we need re-engineer how we treat the patients, how they are coming in, how we take the information, how we triage.
How many times you talk to him
yes.
afterwards? Not
yes.
every half year, but
yes.
many more times,
exactly.
touching points.
And this should be also personalized, that you have like a calendar events in the future, because we know what will happen to you. We know when the medication is over. We know when you should come to lab test. Why we give this back to the patient and say, oh, you should call us after 6 months. No, you put appointment to your calendar and send reminder to the patient that you are asked to come. So it's not anymore demand-based when the patient decides when to come, but it's need-based. I know what is best to you and I help to go you through.
Okay. Well, I think that is a great goal, and that's 100 times more difficult than a digital system. But okay, change the doctors, change the system, change the patient. Two questions for one thing. One, when you went to Finland and you tried to implement the Estonian system, how was that accepted? The digital system.
Yeah, the X-Road and the digital society. It was quite difficult because.
Which year was that?
It was 2012.
Okay.
So it was. Finland had also economic crisis at the time, and they tried to find new projects to be able to go through this economic crisis, and I was together with the board members of Finnish Innovation Fund, and I came out and said, why you are not taking the same approach than Estonia has? That we have one system for all sectors, and we are like it's cost effective, it's distributed.
Yeah, great.
So
we have great
yeah,
results.
And it's working.
And you also gave it away, right? You gave away.
Yes,
it was
and,
open source.
Yes, and we agreed with different decision makers that let's offer this as a let's say gift or
yeah.
free of charge to Finland, and let's develop it further together.
Yeah.
And then it was done in such a way, and now it's the Nordic Institute of Interoperability, which is NGO, and now Iceland is also taking part of it. And together, these three countries developing further this digital environment. But
okay. So it works. In the end,
it is.
They
yeah,
accepted it and they like it, and you develop it together.
Yeah,
now.
but I'm medical doctor. I'm not IT.
No, but you spent 6 years in Finland, and you've also spent 6 years in Estonia.
Yes.
And you're also a medical doctor. You still have a whole bunch of practices to manage.
So, but I had to convince Finnish IT companies and IT architects that what is X-Road about and what is the benefit of that.
Yeah.
So
6
this was
years. Yeah.
Yes.
So that's nice. But you offered it to all the countries.
Yes.
And these are the only 3 countries, Iceland, Finland, who basically accepted it. Why not 20 more?
No, it's more than 20 countries who have using fully or because it's open source.
Yes.
So
they can use part of it.
Yes, they can use part of it or some concept of it. So more than 20 countries worldwide. Okay. But these 3 countries are like financially developing it further. So this is the NICE is doing. So they are the developing it further.
Great. Last country I wanted to ask, what's now the most sophisticated digital country of Europe? It also always used to be Estonia.
It's Ukraine.
Ukraine?
Yes.
Tell me the story about Ukraine. I mean, because I don't think of Ukraine as a sophisticated IT country.
Ukraine started to develop their X-Road similar system in maybe 10 years ago after the first revolution and democratic government.
Oh, 2014.
And, and Estonians were helping them. And they even developed it further. They didn't stay on the computer level. They went directly to the mobile. Now they have a country in mobile solution. So in that sense, they are more developed than Estonia. We now.
Is it also document based, or is it also more advanced in that way?
I think it's more advanced because it's more service oriented and more like a proactive service. So and you can do a lot much easier to have a mobile services than have a document based computer system like we had, because we came from paper.
Yeah.
But they skipped this paper version immediately.
Yeah. And they also use it to report on what the Russians are doing and if everything. I mean, they use it for lots of different things.
Yeah, yes. I think it's you very hardly see in information of where the Ukrainian troops are moving or things, but you see a lot of information about what Russians are doing, what crimes they are doing. Everything is documented because you can use an app and have a location and document it easily.
Yeah, and also the 8 million people which fled the country, they are using it too.
Yes, and they are using e-school and different service. Even they are living in Estonia, going in Estonian school, they are still using Ukrainian governmental service in mobile. So they are still part of the community, even they are abroad.
Yeah. So they are using their crisis, their huge crisis. They're using it all to make the country more efficient.
And I think it's also the necessity, because most of the infrastructure is destroyed.
Yeah.
So, and if you don't have digital services, if you still have in paper, you are like collapsing all the society.
That's true.
Yeah.
Is Estonia, is Ukraine also changing, in terms of corruption and being disorganized? Is that also changing now?
I think it is a change already, because when you building this e-nation in mobile, it means that everything is transparent. Previously, Ukraine was very strong, these different regions. The governors of the regions were the king. They are small kingdoms. Yeah. But now everything is centralized because the services, and it gives much more transparency than the local authorities. Still, there is a problem of corruptions and missings of financial support and not all is functioning, but the mobile solutions, it's easy to keep up the network much easier than have the physical infrastructure.
Yeah. Last question I wanted to ask you about your latest crisis, and that was COVID. And you said that 10 years nothing happened actually after the healthcare system was ready. But in COVID, things changed, and especially that the remote visits really went up very highly. That happened the same in Holland. But after the COVID was gone, everything went back to normal. How did that happen What happened in Estonia?
I think the good crisis is always very good opportunity to have some kind of jump in at least in digital. So I have been used, like for example, teleconsultation for 20 years. Yeah. It was not legal and it was not paid, but thanks to COVID, it took only a few weeks to agree between doctors, health insurance, that it's covered and it's preferable way to communicate because it was lockdown.
Yeah.
So, and it was only possible to communicate with your patients, not being able to visit them physically. But after first wave of COVID, it relapsed because it was too short, this experience. But then came second and third wave, and it changed all. Now, 52% of Estonian contacts with caregivers are remote contacts, and it's growing, and it's more, let's say, higher quality. We are building new digital platforms. It's not only phone anymore. We have video consultation. We have different chat, and we are trying to build chatbots. We have speech recognition technologies coming to so it really made a huge jump because of that, and now it's stabilized. Yeah. So it's not going back anymore.
Yeah, no, and it's 60% of the contacts. Okay. AI, what do you think of what will AI do? It's now, since December, it's very top of mind. What will that do to the system?
Maybe it's not very favorite to hear of doctors, but I think that we will have we don't have a shortage of doctors anymore after 5 to 10 years.
Because of AI.
Because of AI.
And now you have a big shortage.
Yes. Yeah. And it does not mean that AI will replace doctors, but AI will help to triage the right persons who will should see the doctor, who will see the specialist, who will see the nurse. So it helps us to collect the data, make triage, and decide who is the better caregiver for this purpose, for this particular patient.
Mm-hmm. And the doctors will be helped with AI to make faster decisions, better decisions.
Faster decision, and I just give one example. We are using symptom checker, which gives also the probabilities of different diseases. And one doctor said that usually you think that okay, the most relevant is the reason of what to treat, but the patient has come several times and they haven't found the right treatment, and then they looked the symptom checker. There was like one other disease which was only 5% probability, what you never think in the first order, and they went to this path and they did an additional test and came out it was right one. So. But in normal life, you take the most common thing and go to treat this.
Just like Google,
yes.
Number one on the line, yeah.
Yes, yeah. But now it gives you different options and also probabilities, and the doctor said that they will become a better doctor if they have these tools in place.
We have this test where we had 1,000 patients ask questions to ChatGPT and doctors.
Yes.
And they were judged by other doctors on how complete was the answer, how good was the answer, and how what was
empathic.
The empathy.
Yeah.
And they scored much better. ChatGPT scored much better when it was trained on. So we'll see how that goes. Hey, you've been working as a GP. You're an entrepreneurial. You have a lot of different companies. And you've been also very much busy with the national system, with the public, the public good. Is that appreciated? Because you're always ahead of the people. Now you're ahead again. Do people appreciate somebody in the healthcare system which is constantly pushing for something new?
No, it's vice versa. You are more hated than appreciated, because it's hard to sometimes understand If you are too far ahead, you are already having on your mind everything ready. But to explain it very simple way to those who just don't want to follow, it takes time. But if I look back for 10, 15 years, I see that most of the things that I did, what I spoke, are true and they are happening.
Yeah, but you were right. But do also people acknowledge that you were right?
No, they have forgotten who did it.
Thanks for fighting for the future. Appreciate it.
Thank you.